Yep.
Welcome to the Manifesting Health Series. I'm Curry Bordelon, your host for this discussion. The Manifesting Health Series provides engaging interviews with experts in men's health. Today, we're excited to have Dr. Loretta Lee join us for this episode, Equitable Care for All Men. Dr. Lee is a professor for the UAB School of Nursing as an awarded educator, leader, and clinical practice expert. Dr. Lee bridges healthcare and policy gaps using expertise to expand access, advocate for equity, and influence state and national programs. Welcome, Dr. Lee.
Thank you, Dr. Bordelon. Thank you so much. Warm introduction.
Thank you so much. I appreciate you being here and sharing your expertise with us. So, as we get started, can you spend a little bit of time talking about yourself and how did you get into the space of equitable care and really trying to help diverse populations?
Right. Well, that's a great question. What really led me into health equity stems from a personal background. My father and several of his brothers had chronic diseases such as diabetes, which caused my father to have a shortened lifespan. So when I went through my PhD program, or when I started my PhD program, I thought I needed to solve world hunger. And then I figured out, okay, well, I can't solve world hunger in just these few years. So what can I do? I knew I wanted to work in the equity space, health equity. So I started to look at chronic diseases such as diabetes, and that led me into seeing that there were disparities based on racial lines, ethnic lines, and gender lines. So that's really the beginning, which is when I went through my doctorate program.
So I want to continue with your train of thought. You just started talking about those disparities in care, and gender, age, race, and so forth. You started talking about those disparities a little bit. Can you spend a little bit more time on where we are? Can you talk about where we are as a healthcare entity, as far as a healthcare system, if you will? Where are we with this disparities? How are we bridging gaps? Or we still have gaps? Where are we? What's the current state?
Right. Well, I think we all know we still have some work to do. We still have health disparities. Those health disparities exist between races, those health disparities exist between genders. When we think about men in general, those health disparities exist between Black men and their other counterparts. So, say, for example, in chronic diseases, like I just mentioned, diabetes, hypertension, certain cancers, Black men have higher incidence of those diseases. We are making some strides in eliminating those disparities, but we still have some work to do. And there are some things that I've identified through the time that I've been working with health disparities or health equity that I think we can do to continue to improve the state of Black men, specifically Black men's health. Again, we're making strides. There are fantastic programs that are out there that address health disparities amongst Black men, but we still have a ways to go.
Can you tell us a little bit more about those initiatives? Maybe what are some of the things out there that's been successful in helping bridge the gap, not only with men, but also men of color and Black men of really trying to improve outcomes in a population that remain statistically challenged?
Okay. Well, let me kind of just go back and give you a little bit of a background. We know that health disparities for Black men in the United States has been around for quite some time. It dates all the way back to slavery, all the way through um, health disparities, all the way through economic challenges and whatnot. So these disparities have been well documented, I mean, for over 150 years. We know that Black men, as you mentioned, are disproportionately affected, and as I mentioned, by chronic diseases compared to other racial and ethnic groups. They experience higher rates of conditions such as the big ones, as I say, hypertension, diabetes, cardiovascular disease, chronic kidney disease. They have a lower life expectancy of any other or any major racial or gender group in the US. Now, for men in general, the life expectancy is 7 years less than their counterparts. For Black men, it's 6 years shorter than white men. And when you compare those same Black men to Black women, it's 7 years shorter. So that's a huge disparity that we have to address. I mentioned some cancers, and when I give talks like this, I always like to kind of hone in on the cancers that we uh, know a lot about or that we hear most about. And we know that they're more prevalent in some races. So when we look at cancers such as prostate cancer, the prevalence, or rather, it's more likely to be diagnosed in Black men, and they die from prostate cancer at a earlier age. That's partly because of more aggressive type cancers that they're diagnosed with. Some of it is because of genetic risk and whatnot. Less frequent screening. So there's disparity there. Prostate cancer, which is something that, if caught early, we can do a lot to address. Um, Lung cancer, the mortality rate is over 15% higher in Black men. Colorectal cancer, more likely to be diagnosed at a younger age in marginalized populations as compared to their counterparts. So we've heard a lot about factors that affect these conditions. We know about the common ones. We know about social determinants of health. We know about healthcare access and utilization. We know about structural racism and discrimination. We know about high exposure to risk factors. We know about what I just mentioned, genetic and biological factors. So, what can we do? We've already started. The state of men's health is improving because we've already started some initiatives. But before we go into what's working, what's not working, let me tell you a little bit more. As far as the factors that contribute to the disparity amongst this population, when we think of social determinants of health, we know we have to first think about economic instability, lower access to quality health care, food insecurity, unsafe housing conditions. All of these factors contribute to poor health outcomes amongst this population. When we talk about health access and utilization, Black men are less likely to consistently access or to have consistent access to preventive care. And then they may delay seeking medical attention due to factors such as financial barriers, mistrust in the healthcare system, lack of cultural competent providers. I don't think I really have to go into the impact of structural racism and discrimination. Want to talk just a minute about higher exposure to risk factors. So, Black men specifically are more likely to experience stress, food deserts, environmental hazards, um, and lower access to safe space for physical activity. So, what can we do? What have we done? So, addressing these disparities requires a comprehensive approach. So that means it's just not one intervention that's going to make everything go away. Our federal government has already done some things to address health disparities amongst Black men. So, for example, the HHS, the Health and Human Service, U.S. Health and Human Services Department, and the CDC, they both have implemented various initiatives to address health disparities amongst this population. So I call them initiatives, but under the federal government, there's really no specific program called Black Men's Health Initiatives, but there are initiatives that target these populations. So, for example, under the HHS initiatives, they utilize the Office of Minority Health to lead efforts to improve health of racial and ethnic minority populations through the development of health policies. And I mention health policies because that's my theme. So health policies and programs. Their initiatives focus on disease prevention, health promotion, and elimination of health disparities. Now, I'm going to go on if you don't stop me and say, let me ask you another question. So you
No,
can
that's
see
okay. No,
my passion.
yeah, this is incredibly informative, and I appreciate the lens that you're providing to us, not only from a provider, but also an economic, social side and from an advocacy side. So I really appreciate the comprehensive approach. And you mentioned some things just a few minutes ago about access pieces. We know that men routinely delay actually accessing routine preventative care. Do
Right.
you do you see that not only as a male, men of color or black males are not only delaying their access for routine care, but delaying access when there is a challenge or is a complication, putting it all further down the road. And in doing so, we know that the data says individuals who do delay care or even seeking treatment for something questionable of concern actually they can jump to a stage 3 cancer or
Right.
there are more advanced illnesses. Do you see that's also true in populations like populations of color?
Exactly. That's totally true. One reason behind that is culturally, the way um, men of color were raised in terms of being the masculine one, being slow to complain about things, sometimes even ignoring what's right in your face. Uh, they're just raised to maybe ignore that. And then that causes them to not seek care until it's further along, such as prostate cancer. That's one thing that if care is sought out earlier, could more than likely be eliminated. But oftentimes when they do seek care, it's in latter stages, and that is strict. Well, that's related to culture for one thing. It's related to access, number two, and it's related to basically many Black men suffer socioeconomic issues, just as other minority populations that have lower socioeconomic status. So if you have a lower socioeconomic status, then you're going to be slower to seek medical care. You may not have health insurance,
Right.
for one thing.
So
Uh,
you mentioned cultural, you talk about cultural competency and cultural congruency whenever you're caring. So as what can we do as providers, as nurses, as educators, and advocates, what can we do to help bridge that gap and improve that cultural competency in being able to care for this population?
Great question. So one thing I think is to really hone in to some of the initiatives that have already been put out in space, some of the initiatives that have been created by the federal government. For example, there are programs that are brought into barber shops that target African American or Black men, and they do everything from blood pressure screenings to diabetes screening. There are even mental health screening programs in which barbers in Black barbershops, or I should say, Black barbers, are trained to be advocates and to open that conversation with Black men about mental health so that they can decrease or eliminate the stigma of mental health. And just speaking about mental health, that's something that we really don't focus on a lot because there's in the African American community or the Black community, there's really a stigma associated with uh, mental health issues. So sometimes a mental health issue can just be situational. I'm thinking about depression, short-term depression, but we're taught not to talk about that, and Black men specifically are taught not to talk about that with other men. But in a barber shop where they are already sharing information about various issues, that's a fantastic place to start the conversation.
Yeah, in that sense of community is really a powerful message the sense of community within our veteran population, within this, our population, all populations really, and trying to bridge that gap and those disparities among men. Dr. Lee, this has been a very informative conversation. I really appreciate your time. In our last couple of seconds we have together, do you have a takeaway message for our listeners?
Right. I guess what I would say is there's still a gap, as we know, in terms of the health outcomes for Black men in comparison to their counterparts. So I would say that we need more research in terms of those in the research space. For practitioners, we need more practitioners to be willing to work in that space. And as a nurse practitioner, I do have to put in a plug for the Nurse Practice Act, nurse practitioners expanding practice capabilities, because we do know, as you just said, that if you're cared for by a person who has the same lived experiences as you, that you tend to maybe have better outcomes. So if we can expand nurse practitioner practice in areas where physicians maybe don't want to go, or can't go, that would enable them to be cared for by Black nurse practitioners and have the potential to improve outcomes, health outcomes. For the Black men who are listening, I would say that you need to pay attention to the signs and symptoms that are going on with you. Pay attention to your health. Don't be afraid to talk to someone that you feel is a trusted community care partner, such as a barber who has had this training, because they can offer you valuable information if you are uncomfortable with going to your traditional physician. So it's a continuum. I would think it starts with what we can do at the federal level, state level, local level, and then also bringing it down to the individual. The individual does share some responsibility as well in terms of making sure he has better health outcomes.
Thank you so much, Dr. Lee. I appreciate your time. This has been a great conversation about a much needed topic. So we really appreciate your time. And thank you all for listening and watching the Manifesting Health series. We'll see you next time.
Thank you.